Cardiac tamponade. Introduction. Cardiac tamponade is a life-threatening condition characterized by the accumulation of fluid in the pericardial sac, leading to compression of the heart and impaired cardiac output. It is a medical emergency that requires immediate intervention to prevent circulatory collapse and death. The condition can result from trauma, infections, malignancies, or medical procedures affecting the pericardium. Definition. Cardiac tamponade is a condition where pericardial fluid accumulation leads to increased intrapericardial pressure, restricting ventricular filling and reducing cardiac output. Cardiac tamponade is a critical condition caused by excessive pericardial fluid, impairing normal cardiac function and leading to hemodynamic instability. Etiology. 1. Trauma-related causes. Blunt or penetrating chest trauma, example stab wounds, gunshot injuries. Cardiac surgery complications. Cardiac catheterization or pacemaker implantation injury. 2. Non-traumatic causes. Pericarditis, viral, bacterial, or tuberculosis-related inflammation. Malignancies, lung cancer, breast cancer, lymphoma metastasis. Uremic pericarditis, due to chronic kidney disease. Autoimmune diseases, systemic lupus erythematosus, SLE, rheumatoid arthritis. Aortic dissection, rupture of an aortic aneurysm into the pericardium. Hypothyroidism, myxedema-associated pericardial effusion. Risk factors. History of pericarditis or pericardial effusion. Undergoing cardiac surgery or invasive cardiac procedures. Trauma to the chest. Cancer with metastasis to the pericardium. Chronic kidney disease, leading to uremic pericarditis. Connective tissue disorders, example lupus, rheumatoid arthritis. Pathophysiology. Accumulation of pericardial fluid, effusion. Down arrow. Increased intrapericardial pressure. Down arrow. Compression of the right atrium and right ventricle. Down arrow. Restricted ventricular filling during diastole. Down arrow. Reduced stroke volume and cardiac output. Down arrow. Compensatory tachycardia and hypotension. Down arrow. Circulatory collapse and cardiac arrest, if untreated. Clinical manifestations. Early symptoms. Fatigue and weakness. Shortness of breath, dyspnea. Chest discomfort or pressure. Lightheadedness or dizziness. Advanced symptoms. Severe hypotension, low blood pressure. Tachycardia, rapid heart rate. Jugular venous distension, JVD. Muffled or distant heart sounds, due to fluid accumulation. Pulsus paradocus, drop in systolic blood pressure greater than 10 mmHg during inspiration. Cyanosis, bluish discoloration of skin and lips. Cold, clammy skin due to shock. Diagnostic evaluation. 1. History taking. Recent history of chest trauma, cardiac surgery, or pericardial disease. Symptoms of dyspnea, dizziness, chest pain, and fatigue. History of cancer, kidney disease, or autoimmune disorders. 2. Physical examination. Beck's triad, classic signs of cardiac tamponade. Hypotension, low blood pressure. Distended neck veins, jugular venous distension. Muffled heart sounds. Tachycardia and weak peripheral pulses. Pulsus paradocus, exaggerated decrease in blood pressure during inspiration. Cold extremities and cyanosis. 3. Specific tests and procedures. Electrocardiogram, ECG low voltage QRS complexes, electrical alternans. Chest X-ray, enlarged cardiac silhouette, water bottle sign. Echocardiography, 2D echo pericardial effusion, right atrial or ventricular collapse. Cardiac catheterization, confirms elevated intrapericardial pressure. Arterial blood gas, ABG, analysis, shows metabolic acidosis due to shock. Medical management. Emergency pericardiocentesis, needle aspiration of pericardial fluid to relieve pressure. Intravenous fluids, IVF, maintains preload and prevents further hypotension. Oxygen therapy, supports tissue oxygenation and reduces hypoxia. Inotropes, example dobutamine, dopamine, increases cardiac output in severe cases. Nonsteroidal anti-inflammatory drugs, NSAIDs, and steroids, reduces inflammation in pericarditis. Antibiotic therapy, if tamponade is due to bacterial pericarditis. Surgical management. Pericardiocentesis, emergency needle aspiration of fluid from the pericardium. Pericardial window surgery, subxiphoid pericardiostomy creates a small opening in the pericardium to drain excess fluid. Pericardiectomy, surgical removal of part of the pericardium for recurrent pericardial effusions. Balloon pericardiotomy, uses a balloon catheter to create a drainage passage in the pericardium. Nursing management. Decreased cardiac output related to cardiac compression. Monitor vital signs, especially blood pressure and heart rate. Prepare for emergency pericardiocentesis. Administer 4 fluids to support circulation. Ineffective tissue perfusion related to reduced cardiac output. Assess capillary refill time and oxygen saturation. Provide supplemental oxygen therapy. Monitor for signs of organ failure, example kidney function, altered mental status. Risk for shock related to hypotension and impaired circulation. Keep patient in a semi-Fowler's position to reduce dyspnea. Administer prescribed inotropic medications to maintain cardiac function. Monitor urine output and mental status for early signs of shock. Anxiety related to breathlessness and life-threatening condition. Provide emotional support and reassurance to the patient. Explain all procedures to reduce fear and anxiety. Prevention. Early treatment of pericarditis to prevent excessive fluid accumulation. Careful monitoring after cardiac surgery or trauma. Timely drainage of recurrent pericardial effusions in high-risk patients. Management of underlying conditions such as cancer, kidney disease, or infections. Complications. Cardiogenic shock. Multi-organ failure. Cardiac arrest. Recurrent pericardial effusion. Death if untreated. Conclusion. Cardiac tamponade is a life-threatening condition requiring urgent diagnosis and treatment. Early recognition of symptoms, rapid pericardiocentesis, and appropriate medical or surgical intervention can save lives. Preventive measures such as timely treatment of pericarditis and careful post-cardiac surgery monitoring are essential in reducing the incidence of this fatal condition.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.